Silva from the Porto Municipal Police and Dr. Mariam Jashi from Unite. You're both incredibly welcome and thank you for joining us. Before we begin, a note on privilege. I remind members and witnesses of the long-standing parliamentary practice that you should not criticise or make charge against any person or entity by name or in such a way as to make him or her identifiable or otherwise engage in speech that might be regarded as damaging to the good name of the person or entity. Therefore, if your statements are potentially defamatory in relation to an identifiable person, you will be directed to discontinue your remarks, and it's imperative that you deploy with any such request. I also like to remind members of the constitutional requirement that in order to participate in public meetings, members must be physically present within the confines of Leinster House complex. Members of the committee attending remotely must do so within the precincts of Leinster House. That is due to the constitutional requirement that in order to participate in public meetings, members must be physically present within the confines of the place where Parliament has chosen to sit. In that regard, I would ask any member partaking via Microsoft Teams prior to making your contribution that you confirm that you're on the grounds of the Leinster House campus. We're engaged with witnesses, so we'll have 5 minutes to deliver their opening statements to allow plenty of time for questions and answers, and if necessary, further or more detailed information can be sent to the clerk for circulation to members. For their opening statements, I would now like to invite Mr. Da Silva to deliver your opening statement. And thank you for joining us again.
Okay, thank you so much. First of all, I would like to extend my compliments to the Parliament and to this group, and it is indeed a great honour to be here. Just one small correction. I'm the head of National Police up north in Portugal. I was recently appointed to a new job.
Congratulations.
And, okay, thank you so much. And that is a disclaimer as well to make, because English is not my native language, and you will find that out very soon that English is not definitely my native language. So be patient with me. Okay. The statement, the decriminalisation of drugs in Portugal implemented has been widely regarded as an innovative response to the challenges posed by substance dependence. Rather than adopting a punitive approach, the Portuguese model seeks to address addiction through a biopsychosocial framework, recognizing the complex interplay between biological, psychological and social factors. Its shifts raise important questions regarding the nature of drug-related offences and the appropriate role of law enforcement. Specifically, it invites reflection on whether drugs use should be treated as a conventional criminal matter or a victimless offence imbibed within broader social and health dynamics. Traditional drug policies have often framed substance use as a criminal issue, emphasizing punishment and deterrence. However, such approaches frequently fail to address the underlying cause of addiction and may exacerbate social exclusion. In contrast, the Portuguese model redefines the drug user as a patient rather than an offender. This reclassification enables a more flexible and human response, directing individuals towards a treatment and support service. The decriminalisation of drugs does not eliminate the role of the police. Rather, it transforms it. In Portugal, police officers remain responsible for identifying drug use, seizing illicit substances, and referring individuals to the Commission for the Dissuasion of Drug Addiction. This raises a critical question. Has the role of the police fundamentally changed, or merely its formal expression? On one hand, law enforcement continues to bear a substantial operational burden. On the other, the nature of police interventions has shifted towards facilitating access to health-orientated responses. Importantly, police officers operate on the front line of social reality. Due to their constant exposure and immediate response obligations, they are frequently called upon to address situations that extend beyond strict legal enforcement. While it would be reductive to view police as a de facto social worker, their role increasingly intersects with social and public health domains, particularly in the context of drug use. One of the most significant contributions of the Portuguese model lies in its ethical reorientation by treating addiction as an illness rather than a moral failing or criminal act. It promotes dignity and reduces stigma. Despite its successes, the Portuguese model faces ongoing challenges. The resurgence of visible drug use in public spaces has ignited debates and raised concerns about the effectiveness of current strategies. At a broader level, the increasing proliferation of drugs across Europe underscores the need for continued reflection and adaptation. Drug policy must remain responsive to evolving patterns of use, trafficking, and social impact. From a professional police perspective, the distinction between the pre- and the post-decriminalization period is significant. Having operated in both frameworks, it is evident that the latter has produced more positive outcomes for society and for law enforcement institutions. While the system is not without flaws, it has reduced the burden of criminalization and allowed for more constructive engagement with individuals experiencing addiction. The Portuguese experience, I'm just finishing, demonstrates that drug decriminalization, when combined with a robust public health response, can provide a more effective and human approach to substance dependence. It challenges traditional concepts of crime and punishment, particularly in relation to offences that lack a clear victim, yet have a profound social consequences. Nevertheless, the model requires, as I mentioned, continuous evaluation and refinement. The complexity of drug-related phenomena demands a balanced approach that integrates law enforcement, public health, and social support system. Thank you.
Thank you, Mr. Da Silva. I'd now like to invite Dr. Jashi to deliver your opening statement. You have 7 minutes, and thank you for joining us. 5 minutes, sorry.
Thank you, distinguished colleagues. Mr. Chair, it's an absolute honor to join the session of the Joint Commission today on behalf of Unite Parliamentarians Network. Even though I am the former Member of Parliament and Vice Minister of Health of Georgia, I will be speaking today on behalf of Unite, that brings together 545 legislators from over 120 countries. Unite is the only network of parliamentarians, both current and former, that shares the commitment of advancing global health, advancing better health through better policies. And Unite has been operating the drug policy desk, the global drug policy desk, that has promoted and supported legislators across different regions in adoption and enforcement of evidence-based drug policies. Unite has focused on three major dimensions. First, it was the sustainable harm reduction service integration in universal health coverage services. Second, alternatives to incarceration and discrimination. And third, regulatory frameworks for cannabis. And Open Society Foundation has been supporting these efforts. From our work, I would like to highlight a couple of country examples, and we have already heard from Mr. Antonio the excellent example of Portugal that is the most cited international example. Portugal has the 25 years of experience of decriminalizing the drug possession for personal use that has led to substantial reductions in injecting drug use associated HIV infections and, more importantly, drug-related deaths. The second example we would like to focus is Switzerland, that has introduced four-pillar balanced approach built on harm reduction, treatment, prevention, and repression of illicit markets 3 decades ago. And this model has led to 50% reduction in overdose deaths, 65% fall in HIV infections, and 80% drop in new heroin uses. And you could also refer to Unite's Geneva course on drug policy that more explicitly describes the Swiss example. We are also delighted to note and welcome Ireland's initiative in establishing the Joint Committee on drug use in response to recommendations from the Citizens' Assembly. And Unite also cites Ireland as an example, not only for the substance of your policy discussions, but for your approach that's based on inclusive deliberation, cross-party engagement, and clear commitment to bringing evidence into parliamentary discussions. We're seeing growing regulatory efforts around cannabis in Canada, Uruguay, parts of the United States, and we see that drug policies are no longer theoretical discussions. And we also see geographic expansion of the drug policy dialogue, with engagement of legislators from Kenya, Mexico, Pakistan, Zimbabwe. We will soon start work in Malaysia and Ghana. And Unite has supported regional dialogues in Europe, Latin America, and the Caribbean. Most importantly, in 2024, Unite helped launch the Manifesto for a Progressive EU Drug Policy. While we are proud to witness the drug policy reforms, we have to be also aware that the sustainability of this hard-won effort for drug policies would be extremely difficult against the reversing trends in democracy and human rights. The latest report of Freedom House in 2024 reported 19 consecutive years of global freedom decline, with fewer citizens living in free countries. And in this context, we all, both at national, regional, and global levels, should expect that policies would shift towards harsher approaches, and we risk turning drug control into a tool of repression. So to conclude, like 4 major messages from international perspective. First, we must ground every important policy decision as parliamentarians in data and evidence. And in this respect, I would like to highlight 2 important documents that I'm sure our fellow legislators will find interesting. Global Drug Policy Index, launched in 2021, that summarizes the 5 dimensions of drug policies through the absence of extreme punishments, proportionality in criminal justice, response, health, harm reduction, and development and human rights issues. And also the recently launched Health Policy Trend Report by Unite that summarizes good examples of evidence-based policies across different dimensions of global health, including drug policy. Second, we must move beyond the false choice between public order and public health, and effective policies can and must do both. And both Portuguese, Swiss, and other experiences have documented that effective reforms should be paired with investments in care, housing, prevention, reintegration, and community-led services. Third, we have to ensure that people most affected by drug policies are part of the policy discussions. And finally, as parliamentarians, we have unique opportunity. We legislate, we oversee budgets, we convene public debates, and we can insist that drug policy is judged not by ideology, but how it reduces harm, saves lives, and protects dignity. Thank you.
Thank you so much, Dr. Jashi. So members, over to yourselves. You have 7 minutes for questions and answers. And in the rota that was circulated prior to the meeting, Deputy Anne Graves, you are first.
Thank you both for your excellent presentations. It's really great to hear your experiences and the work that you've done over the years, particularly in promoting an evidence-based approach to drugs policy. I'll start with you, Mariam, if that's okay. One of the big takes, or one of the things that jumped out at me from your presentation today, was the significant drop in drug-related deaths in Portugal. It's worth noting that drug-related deaths here in Ireland are more than twice the EU average. So from the stats that we have, there were 343 in the south and a further 169 deaths in the north of Ireland in 2023. So I'd really like to hear what you think the practical steps that we could take here to reduce the harm done by drugs, particularly, drug deaths, and how we can ensure that we have a really comprehensive health-led approach for drug use, and where we can help and where we can reduce those awful losses.
Absolutely. Thank you so much for the question. And I will use the opportunity that Unite is in the unique position to share Portugal's example in full details. First of all, I'm sure Antonio will comment and add to my response and I'm sure it will be important to hear his perspective. I have personally witnessed how harm reduction and the integrated drug policy reform works in Portugal. That is exactly based on the needs of the most vulnerable people. We have seen not only the community centers for reintegration, but the replacement mobile clinics for ensuring that there is no barrier towards accessibility of replacement treatment for the drug users. And we would be delighted from Unite Secretariat in Lisbon to provide the full package of Portuguese data, evidence, and the details of the prevention, harm reduction, reintegration, and the other two pillars of the program. And we would also be delighted to propose a study visit if you would be interested to see the hands-on experience and how in daily practice this very effective policy works in Portugal. But it has been a very balanced policy approach, and what we see mutually enforcing collaboration between public health and law enforcement institutions in the country.
Thank you for that, and we would absolutely be delighted to, if you could share the data with the members of the committee. That would be great. Antonio, our own Citizens' Assembly on Drug Use recommended a comprehensive health-led approach. This was more in line with the Portuguese model rather than a traditional punitive model. But unfortunately, the draft national drug strategy that we received now, it's still only in draft form and open to public consultation at the moment. It doesn't really reflect the positive, progressive health-led approach, and the drug strategy also moves away from there's no reference to social economic causes of the drug crisis. So what would you think the key steps that we should take to ensure that our drug strategy reflects a health-led approach and the strategy tackles the causes and the consequences of the drug strategy? And then just as a second question to you, we had our department, government department was here, and the Gardaí in particular, and we were talking about changes in legislation around punitive situations for people that were in possession of drugs for personal use only. And the argument against changing the legislation was really that if people were stopped and had only a small amount of drugs on them, the department felt that you would have the likes of big drug dealers using people and using small amounts while having a large stash hidden behind a wall. And because of that, they didn't want to change the legislation. It's kind of a bit nonsense as far as I'm concerned, but I'm just wondering what your take would be on that.
Okay, thank you for your questions. Well, let me tell you a little bit about our experience from Portugal. As I mentioned in my first statement, I lived before the legislation of 2000 and after. And there is a huge difference before 2000 and right now. Even though that we have a hiccup in 2011, that when IDT, that was the Institute for Drug Use, was extinguished because of the Troika intervention in Portugal, that I think we had a step back. But let me tell you one thing. I know exactly what are the concerns from the police side, especially because even though that in the trafficking strategy. If they reduce the amount of drugs, they can split the drugs, and if they have a police intervention, we are not going to arrest them. But I think it's a very reductive way of thinking policing in society. I think one of the challenges is for the police. The first one is, and it is very clear from my point of view, it's, drug users are, in our perspective, they are not criminal, definitely are not criminal. They are victims of a system. And that's, I think, is the first step that we should have to address this issue in a conscious way. Secondly, the police is going to be still on the ground. Even though that I may not understand in a certain way why there is still a police action to refer individuals to the Dissuasion Commission, because I think the police should step a little bit back from that. But at this stage, what we have in Portugal, and our numbers are evident, the drug-related deaths that we have when we compare these numbers with Ireland or Scotland, for example, are incredibly low. And that, as Mariam mentioned, one of our key points of success was, I think this moral and this straight approach to drug users, not identify them as a criminal issue. And I'm sure that being a police officer, as I am, it requires a long period of reflection and adaptation from the police force and from the police officers, because police mindset is not. You cannot switch the police mindset with the legislation. It takes time, okay. And even in a 25-year of experience, we still have some problems. But once again, I'm not sure about what's going to be the outcome from your public consultation regarding the law in Ireland. But definitely, if you want to reduce the numbers of people that are killed, in my perspective, unjustified, you cannot find a justification for that.
Thank you.
And if you want to...
Sorry, thank you, Antonio. We're going to move on to our next questioner, and we'll come back if that's okay.
Okay, sorry.
Yeah.
Okay.
Thank you. Senator Nicola.
That's interesting.
Chair, and thank you to both of our witnesses for your presentations today and for being with us. I'm just going to keep going, actually, with the Portuguese model. Mr. Da Silva, if you don't mind, you mentioned in your opening statement that the Portuguese experience demonstrates that drug decriminalisation, when combined with a robust public health response, can provide a more effective and humane approach to substance dependence. So I'm just interested about the two-handed approach and what the rollout was like in Portugal, like which came first. Were both approaches rolled out at the same time? Because obviously without the health-led approach, the decriminalisation becomes a completely different conversation. So can you talk us through, practically speaking, how both of those approaches were rolled out simultaneously, given they were so dependent on the success of one another?
Okay, they were simultaneous because, for the police, it was easy to implement, because suddenly, after the law came into force, the police officers were not enabled to arrest individuals that were possessing drugs. I'll just to remind you one thing that I think is very tricky. What is the amount of drugs that are used for consumption? That's something that is not written in your ID, and that's a very foggy area for the police. That's something that in every discussion, I think you should bear in mind that this undetermined concept sometimes is very tricky for the police. But as you asked me, the intervention was at the same time. From one side, the police was not considering the drug users as criminals, and from the other side, we had a strong and robust public health response to treat them in terms of harm reduction, and especially, suddenly the numbers just came down.
Can I ask you then, you mentioned there that changing the police mindset takes time, and that's probably something that's really obvious, but when you say it out loud, it makes sense. We're human. It takes us time to get used to, new ways of policing and new ways of, treating people, how the law dictates. So I wonder, at the time of the change, when the law came into effect, and I think you had a line there about de facto social workers, and that, maybe more was expected of police officers and a better understanding of, the social issues. Was there extra training provided to the police force when that switch happened, or did you think that was something maybe that police officers needed more support and training with, given their role? I mean, I can't remember where you said it, but there was, so while it would be reductive to view police as de facto social workers, their role increasingly intersects with social and public health domains, particularly in the context of drug use. So given the switch in their role, I wonder, were there extra supports needed or provided for the police officers?
Well, if I rewind, the movie to 99 from 2026, I would say that probably police at that time should have more support, because the world of drugs intersects even police families, and definitely it will take time to change the police mindset, definitely. Because, basically most of the drug users are sources of information for the police, as you can see in criminal investigations. But this has nothing to do with decriminalizing drugs. I think it poses a higher demand for the police to collect information and to bring criminals to justice. But from my perspective, in 2026, I would say that the police should have a different support at the time.
And I suppose then, just focusing on the police force element of it, given that you're a police officer and that is your area of expertise, I wonder, in terms of potential pitfalls for us, or, can you signpost the stumbling blocks? Was that one of them? Was it the cultural shift in the mindset? Was that one of the biggest stumbling blocks in, making sure that the change happened?
Yeah, because it's difficult to change the mindset from criminal to non-criminal. That's going to be the biggest challenge. Of course, there will be a huge reduction of paperwork, a huge reduction of police action with the courts and the prosecutor. But still, I would like to emphasize that it will take time, even 25 years after. And we are talking about a law that was put into 2000. We still have some hiccups, and this is a process. This is nothing that will happen just with the law. Yeah. It will, to change the mindset, it will require a strong approach to the police. Even the way that the police approaches the citizen.
Understood. Thank you, Mr. Da Silva. Dr. Jashi, could you have anything to add in relation to that mindset shift and what we can to be aware of as we try to go down that road?
Dr. Jashi, we can't hear you.
Yeah, sorry. Let me add experience from Georgia in terms of partnership and collaboration with police. Even though Georgia missed its chance 6 years ago when we had an excellent package of drug policy reform, we couldn't reach agreement, like multi-party and cross-party agreement on the dosing component of the policy that Antonia mentioned, that dosing remains one of the most challenging issue in terms of enforcement. However, other elements of harm reduction, including opioid replacement therapies and community services, have been very effectively implemented in Georgia, starting in 2002 when the Global Fund supported projects were implemented, and then the government took over the implementation of donor-supported programs. And part of the implementation was training of law enforcement representatives, because training and education definitely should be a core component of the balanced approach from public health and public order.
Thank you both. Thank you both very much.
Thank you, Senator Nicole. Our next speaker on the list is Senator Lynn Rowan.
Thank you, Chair, and thank you both for your presentations. I was trying to do a quick calculation. There was some figures done that were released this week through the work, I think, of an MEP that captured that in 2025 in Ireland, 5,400 plus drugs offences came before the court, and when doing an analysis of the district court figures on that, you're looking at near 4,000 of those being for Section 3 alone, which is the simple possession, which is a hugely high number. And I just think, Mr. Da Silva, you're saying about that narrative change, there's a narrative that's being set in Ireland that there isn't people being prosecuted under Section 3. There seems to be this there's nothing to see here, this is not happening, we're already de facto not really applying Section 3. But it does really illustrates to me how potentially abused Section 3 stop and search powers are here in Ireland. Section 15, which are for sale and supply, would be sufficient, I suppose, with the adequate police, I suppose, resource, time and training to use Section 15 if they were worried about supply. And I think I remember, and I don't want to misquote you, Antonio, but I remember in the last Oireachtas committee, you spoke to the confidence that you had within the police force, within your own police force, the confidence that you had in their ability to be able to focus on the real kind of target of what the justice system, which is that supply end. So I'm wondering if you could comment on whether you feel that Section 3 in Ireland's legislation, which is that simple possession for stop and search, whether that is needed or necessary to be able to still pursue sale and supply under different parts of legislation and police powers.
Okay, well, first of all, I'm not very familiar with your Section 3, but I'd like just to comment on what you mentioned. Even in our system right now, even though that is not a criminal offence, you can, for example, to intersect drug users and to take them to the commission, the dissuasion commission, you still have to go through paperwork, police station, seize the drugs, weigh the drugs, and send after the individual to the dissuasion commission. That means the police has still powers of stop and search for this specific matter, but there is no criminal prosecution later on.
And there's nothing that, at no point does a criminal prosecution. So if somebody doesn't attend a dissuasion committee, do they have to admit an offence to be able to receive the dissuasion?
No, to go to the dissuasion commission, they have to say is, well, I'm a drug user, these are the drugs, the police seize the drugs, and we take to the, well, it's still an offence, as you know, it's not a crime. It's, I don't know if it is, the English right name is misdemeanor. Misdemeanor, exactly. So it's a misdemeanor, but still have a reaction from the state's point of view, but it's not a criminal offence. But still, the police is still engaged in seizing the drugs, search, seize, wait, and seal the drugs, and after send the individual to the dissuasion commission, but it's not a crime.
And it's not a crime. In Ireland, what they're saying is a health-led approach is actually an adult caution scheme, and it's at the discretion of the guards, of the police. So it's not an automatic, and it's also strike-based. Would you consider that health-led?
Well, my experience as a police officer for the last 36 years is when you leave too much room for police discretion,
exactly.
Something may happen wrongly.
Exactly, and I think when I was looking at those district court figures, some of the highest numbers are I suppose, very obviously concentrated in some of the larger cities, but I would imagine then when you go deeper into that data of who in those cities is stopped and searched and policed, you get down then, I suppose, to the much deeper question and observations around class. And that actually, if we're having this wider conversation in Ireland where we're saying that drug use is used across all different types of groups and communities in society, but it's not those all different types of groups and cities and groups of people in society who are policed, or that will end up in front of a judge for simple possession. So I'm wondering, from the Portuguese experience, how do you make decisions around where and who is stopped and searched, and is there a social class analysis that has become apparent since the Portuguese system?
No, at all. And we know that when we're talking about different types of drugs, we are dealing with different layers of society. For example, when we're talking about cheap cocaine, we can identify several groups that are using crack, for example. But when we are talking about cocaine, we are talking about different groups. And we don't make any distinctions at all. My experience is that, we don't have that kind of frontier that, you are from a higher class and you are not subject for police intervention. That would be at least very unfair and of course, profoundly illicit and illegal.
But are you more likely, and it's probably different in Ireland than it is in Portugal, but are you more likely to encounter a police persons in particular communities in some of the, say, big cities in Portugal than you are others? So it's not necessarily that a distinction is made when somebody is stopped and searched and then it becomes apparent what type of community they're from. I'm more talking about what types of communities are more heavily policed due to maybe social deprivation.
Well, I understand your point, but we don't make that distinction at all. I know that there are strongholds of drug consumption that they usually connected with social neighborhoods, but our points of interest are not just based on these specific areas.
Exactly.
They are much more wider, and if you want to go deepen in some drug dealing, you have to go to other areas as well.
Good. And I'm out of time, but if I can just ask one more question, which is, can you remind me what the supply currently is in Porto? Is it still 2 weeks, 14 days, or did the supply, the possession?
10 days.
10 days.
10 days. But there was a change in the legislation in 2023, but it's still 10 days.
It's still 10 days.
But once again, it's difficult because we have individuals that are consuming once a day, and we have individuals that are consuming 20 times a day.
Yeah,
so
it's relative.
It depends of time. Yeah.
Thank you.
Yeah, thank you.
Mr. Silva, thank you, Senator Owen. Deputy Brabazon.
Yeah, just thank you both your presentations, but to continue on that conversation around the differentiation of drugs for personal use and those for sale and supply, how do you draw the line between those, those two? I know you've just touched on it there in terms of policing. So how do you decide if somebody has a quantity of drugs, and a person might say, well, I have a supply there to do me for whatever period of time. How do you know when that's not true, and how do you know when the intention is to supply?
Well, it's the 1 million question that you had just asked me, because at the end of the day, you have to cross information with other individuals, because as we mentioned from the beginning, this is not just a police issue. There are social workers on the ground, there are consumption rooms on the ground, and if we can have a sustainable platform of talking, we can, of course, make stronger and wiser decisions. But as you mentioned, and I think your question is very valid, it's very difficult for the police officer to say that this individual just consumes once a day. and because at the end of the day, it's going to be the police experience on the ground that will decide that.
Okay. Just in terms of, you mentioned there is a resurgence of visible drug use in public spaces, and that has reignited debate and raised concerns about the effectiveness of current strategies. How has that debate manifested itself, and what are the arguments for and against now? And has it changed since this policy change came about in the early 2000s?
One of the things that we are currently discussing, and this, of course, and especially with the spike of the drug trafficking, mainly cocaine in Europe, it's what to do with the public exposure of drug use. And that's something that's not, from my view, it's not well debated in Portugal as well. Because the only thing that we criminalize, taking into account our drug law, is when the individual abandoned the syringe. Well, this is a crime. But if they are consuming drugs in public spaces, sometimes there is nothing that the police can do. Well, the police at the end of the day can seize the drugs and send them to the Dissuasion Commission. But once again, one of the things that you should ask is this a police real job, yes or no? Because I still have some doubts.
Okay. We have a legalised drug here in Ireland, alcohol, much like ourselves, and alcohol has done absolutely enormous damage to society over many, many years in terms of domestic violence, in terms of economic deprivation of families, and the social implications of it across generations is enormous. There's enormous difficulties with policing, enormous difficulties with the court service, and all the pressure it puts on. Would you feel the same would be valid in respect of the legalisation of drug use in Portugal, for example?
Well, I understand your questions, but I think alcohol, because we have the same problem in Portugal. But I think we are talking about two different areas. Even though that alcohol probably in some ways produces a much more negative social impact than some drugs, for example. But we are dealing with two different things. Of course, we have legislation that controls the consumption of alcohol in public spaces, like, for example, Netherlands has. But still, I think we cannot compare.
Given your experience in policing, and I suppose one of the big complaints we have here, certainly in Dublin, in my experience, people are constantly complaining about the strong smell of cannabis, and if it's obviously it's becoming more and more prevalent, certainly in my anecdotal experience, that there's more and more use of it, and it's becoming stronger in its potency and the smell, and a lot of people complain about it, and they don't want to have to experience that unless they make that decision themselves that it's something they want to do. Have you ever considered geographical areas in cities or in rural parts where people can consume rather than impose their habit on other people?
No, we don't have to. We don't. But I think taking into account, the experience and the knowledge that I have from other places, well, I think I don't remember any place that established a specific area for drug consumption, and especially right now, even when we have cannabis with a high percentage of tetrahydrocannabinol, even now we don't foresee the need at this stage to have specific areas for drug consumption.
Okay. Just one final question then, in relation to the dissuasion. So if somebody doesn't participate in it, I think you may have answered this already, but I'm not quite sure I got the mechanism. So somebody is found with an illicit drug in their possession for their personal use, and then they're referred to the Dissuasion Commission. And if they don't participate in it, there's no consequence for them. Is that correct?
Well, at the end of the day, it's correct. Even though that is a misdemeanor, they can be fined, but still, well, I think to find someone that is a drug user, that is someone that is ill, I think is to victimize the individual twice.
One of the things that certainly for our own system here in Ireland, for all its faults and all its ills, when somebody had the ultimate sanction of going to court, and the court also held the sword of Damocles over them, well, if you don't go along and seek treatment, then the alternative is potentially a conviction. That's available and has been available in our court system here, and you've nothing like that in Portugal. So that you can persuade somebody to go and seek treatment.
Yeah, persuade to get treatment. I think it's based on the individual freedom as well, because you cannot take that from the equation. But one of the good things is that the numbers, I think, they reveal what was before 2000 and what was after 2000. I'm not taking your numbers, but I, for example, take the numbers of Scotland, for example. They have a huge number of deaths in a 5 million population, and we have below 100 in a almost 11 million population. And I think this number should make us think about.
Okay, thank you, Deputy Brabazon. Deputy Burke.
Thank you very much. Thank you to our guests for their presentations and for the work that they are doing and have done over a long number of years in this area. Can I just ask, first of all, in relation to Portugal, when the law was changed there back in 2000, 2001, what additional support were put in place to deal with the people who were using drugs, and what new processes were put in place as regards health support, and also in relation to, was there training provided to members of the police force at that time as well as regards how to deal with it?
Well, thank you for your questions. As I mentioned before, the training was very little, I have to say. The challenges were made much more on the harm reduction perspective and the public health reaction to the new law, and less from the police side. Of course, the police, as a part of the equation, was challenged to refer the individuals to the Situation Commission. But as I mentioned in my initial statement, you cannot just divide the answers by different layers. You have to balance the response. As I mentioned, there is a social, biopsychological, social answer for this. This will not lay just on the police, that at the end of the day, it was much easier because the police officers didn't have to arrest and send to the prosecutor and later on to the judge. That was very time-consuming, I have to say. But the challenge was much more targeted to the social and to the health system. Because, for example, right now, and we had a spike of the use of drugs right now in Portugal, this challenge right now is not for the police, but much more for the health system again, because of the comorbidities and all kinds of diseases that are connected with drug use.
But here in Ireland, we've introduced a supervised injection facility and opened in the last 13, 14 months, and is proving to be successful in the sense of assisting those who are injecting. I'm just wondering, were similar systems put in place in Portugal at the time, and are they still in place? And is there any lessons that could be learned from them, that we could learn from the operation of those facilities?
Okay, unfortunately, we have a very progressive law of 2000, but the DCRs, the drug consumption rooms they are, for example, in Porto, where the place that I was chief of police before, they have 3 years of existence, and that's something that it's highly critical. And I think it should be questioned, because I think we made the house upside down. I think we made the house upside down. We are just opening the drug consumption facilities like 20 years after the law. And this doesn't make sense at all, because these units are critical units to refer, not just in terms of comorbidities, but still to refer these individuals for mental health support. And that's something that can be easily criticized in our system, because drug consumption facilities are in law since 2001, and they were just implemented, for example, in Porto in 2022.
Okay. And looking at other European countries now, is Portugal satisfied that they have all of the mechanisms in place to deal with it, or are there some new things that are being planned in Portugal, having learned over the last 20-25 years? Is there something further that they intend doing, say, over the next 5 to 10 years to deal with this issue? For instance, one of the problems you have in Portugal as well is that you have a huge tourist population coming in, which has additional challenges, I would presume, because of the volume of tourists coming in. And how is that then how are you able to manage that from the point of view of assisting people who have addiction problems?
Well, one of the things I would like to stress is that if you want a strong policy, and we want a strong tool to tackle this phenomenon, we need money. Definitely, we need to be subsidized for all kinds of strategies that you want to implement. As you mentioned, Portugal right now is a spot for tourist activity, even though that I've checked this information with the DCR, with the drug consumption rooms, even though that we have a very low percentage, probably below 1% of foreigners that are consuming drugs in these facilities. One of the problems that we have right now is, as I mentioned, the public exposure of drug consumption on the streets. And that's something that I think we don't have the right strategy. I don't know if it is a right strategy, or at least a strategy for this. And this, the thing that lies in between police and the Commission for dissuasion, there's something, there is a gap from my perspective, there is a gap that belongs to social workers that are not probably very well worked right now.
Okay, can I just ask Dr. Jashi, in relation to Switzerland, she refers to Switzerland in her statement. Just asking, looking at what Switzerland has done, is there something that we shouldn't particularly be looking at where they have been successful in? I know they have reduced down, for instance, the number of people in relation to heroin use. Is there things that we should now be putting in place in Ireland? As I said, we've opened a supervised injection facility in the last 12 months. It is working. Are there other things that we should now be doing in order to assist people who have addiction problems?
Thank you very much for the question. And I believe hearing from you and your esteemed colleagues, of course, every country has its local context where the policies should be adapted and how best to enforce and balance the approach. And I do believe that in Ireland's perspective, maybe Swiss model could be even more interesting to explore, because it also brings into the human rights and public health approach of prevention, harm reduction, and reintegration, the enforcement of illicit and stronger efforts of illicit drug market control. And we would be delighted through the Unite Drug Policy Desk to provide detailed description of the Swiss model that you could use for your reference. But the results are astonishing, truly. 50% drop in overdose deaths and 80% drop in heroin users. And Swiss also has introduced heroin-assisted health services for drug users where other approaches of drug replacement were not successful. So I do believe that Swiss model could be definitely a very interesting addition to sharing experience for Ireland. But I will use this opportunity as I have to leave. My apologies for another commitment, but since you have already advanced these discussions, I would very much appeal to you and your colleagues that you don't miss this opportunity of adopting a balanced drug policy response, because the examples from Portugal, Swiss, and some other countries have proven that it saves lives. And despite all the challenges that could appear in law enforcement front, I'm sure that the optimal solution can be found.
Okay, thank you very much. Thank you.
Thank you, Dr.
Thank
Jashi.
you. Thank you.
Deputy O'Murphy, you're up next.
That's it. Could I go straight back to Mariam on the basis of when she's talking about the Swiss model, right, and look, we all get the idea where we want to be about harm reduction, and I suppose the best, she's gone?
She's gone. She
Yeah.
said she had this.
Yeah, I know, or something. Yeah. Anyway, it was that point around what does repression of the illicit market roughly 3 decades ago, what does it look like? Antonio, right, to Fulcher Road, it's great to have you here. And I suppose I'm going to follow on that piece around what the guards or the police here had spoken about. And I think if I recall exactly what they said was, in most cases where somebody is done with straightforward, simple possession, it's done on the basis that it is somebody, from their point of view, that is known to them. So they said they saw it as almost a weapon being taken away from them in relation to, disrupting the sale and supply of drugs. Now, I get that a lot of that, it depends on the individual guard, and you're leaving an awful lot, up to them in relation to what determination is made. And I think the Portuguese figures work for themselves. On some level, I'm asking you, you know what I mean, how do we sell it to the Gardaí in relation to a Portuguese model that will also work from a point of view? Because I would also accept, as much as drugs are everywhere, and you say it's very different, let's say, from somebody using crack cocaine versus using cocaine, but we have a very particular issue that in deprived areas you have criminal gangs who will use vulnerable people, but who will also engage a number of people in criminal actions. And I always have the issue at times, as much as we're not going to out-police this, the war on drugs is well and truly lost, but it is not okay to leave, I suppose, long-term drug operations, in sight in some of these places where an awful lot of time it's what young people see as that guy's been able to do that for 10 years plus. He lives in a nice house, has lots of money. I think that's a road I can go down. So we need to also deal with that, and also the chaos that is caused for wider communities. And I'll put it to you.
I don't know if I got your question right, but I think I understand all arguments from the police perspective, because at the end of the day they are my arguments as well. But even though that, for example, drug traffickers right now they divide the drugs in small amounts and they send it to the streets just in case the police intersects them, they can always say that they are for own consumption. Yeah. Well, this is a strategy. But at the end of the day, the police work is much more than that. The police's work is much more than that. It's gathering information. Because if at the end of the day, if we prove that this individual that just has, one amount of drug that they can argue that they are for their own consumption, and if we have strong evidence that is for drug dealing, we arrest them.
So that's it. So literally the police, on the basis of wider evidence and investigation,
yes,
can still carry it out. So what you would say to the Gardaí is that this thing they want to protect isn't an absolute necessity to do the work that they want to.
Well, definitely not, because we are still making huge seizure of drugs and search warrants and individual searches, and we are still arresting people based on informations, because we should, all of us know that when the police put some effort to arrest someone and to identify some criminal actions, they tend to change their strategies. But the police, of course, they have to change the investigative strategies as well, because we have some, as I mentioned to you, some cases, actually almost in a daily basis, that they reduce the possession of drugs just to be identified as common drug users. But at the end of the day, we have a bunch of information that we can have against this individual, that we can prove it very clearly that he's not a common drug user, but he's much more, but he's rather a drug dealer.
Well, no, here that's really useful, and I suppose, because the other thing that was said, I think Marta Pinto said it when she was here. She said that at one stage there was an amount, and anything above that was possession from a point of view of sale, but that had been removed. And again, yeah, she said obviously drug dealers, took action around this to try and use that level of flexibility. But I'm working on the basis you're saying that the police in Portugal also have an amount of flexibility, that as much as, right, if they see somebody that they believe is, let's say somebody vulnerable, a drug addict, who is maybe collecting, drugs for themselves and their friends, as much as you shouldn't do that, it's very different from somebody who's part of a drug dealing operation, right? So they can make that differentiation, but they can also, if you're dealing with, members of a drug gang that are working on the basis of only possessing small amounts, that is something that can be addressed by police. There is no restriction in relation to how they operate at this point in time.
No restrictions at all. Of course, any police officer, the police usually they don't like to lose cases in the court.
Oh, no, I accept that.
One of the challenges is to gather strong evidence, and that's what we usually do. Even though that sometimes we are arresting people with a very small amount that could easily be identified as drug for use, but we have strong evidence that lead them for drug dealing.
Then in relation to the Dissuasion Commission, because Martha had also spoken about at times that they have other things they can employ from time to time as regards slight punitive sanctions and whatever. Can you tell me exactly how it works?
Well, it's not my area of expertise, definitely, but that punitive sanctions, as I mentioned before, it's very...
I'm using the wrong term. I'll tell you what, it's more the idea where it was a case of while somebody was dealing with them, that they wouldn't be in a place where, let's say, they were causing a nuisance to themselves, or probably was a place where they were only in it to score drugs or things like that. I think she spoke about the fact that, you would have had people could be... that you would have had a ban on them being in certain areas or possibly going to, let's say, a nightclub or whatever circumstance?
Well, technically, I think that power just lays on the judge's side or on the prosecutor's side. It's not attached to the Dissuasion Commission.
Okay. Now we'll hear.
Because we are restraining basic rights, so I think it doesn't make sense to have hit from a different source.
All right. Okay.
Antonio, Senator Mary Fitzpatrick, I've taken over as chair of the committee, and this is also my time to speak. So thank you very much for joining us today and for sharing with us your experience and expertise. It's incredibly valuable to us. I just want to clarify a couple of things, particularly with the Portuguese model. I think if the committee is agreed, I have questions on the Swiss model and the evidence that was being provided to us by Dr. Jashi, and I would like to follow up with some questions to her on that. But with regards to the Portuguese model, so Portugal hasn't legalised drugs. it has
Yes.
decriminalised drugs. And can you confirm that it has decriminalised all drugs? So, I mean, it's
Decriminalised.
not just cannabis, it's not just cocaine,
It's all drugs. It's all drugs.
drugs. Okay. So can you tell me,
Yeah.
where do users of drugs, where do they purchase their drugs in Portugal?
Where they purchase?
Yeah.
Well, for example, in Porto, there are some specific areas, usually areas where the police has some kind of difficulty in a geographic point of view to have access, and they use that protective environment to sell drugs. And that's usually the strongholds that the police attack once in a while when they have enough evidence to arrest and to seize and to search.
Okay. So, Antonio, I want to be sure I understand this. So when you say there are certain areas, are you saying that there are certain, let's say, streets or housing complexes, maybe
Yes.
clusters of apartments or homes, and in those
Yes.
areas, the drugs are being sold?
Yes, definitely.
Okay. So there aren't regulated establishments, be it a pub or a pharmacy or a licensed premises that has been given
No.
authority to sell. So the drugs are still sold on the black market.
Yes, the only, just the methadone is administered by the public system, but the other drugs are all in the black market and they are all criminalized.
Okay. So would you say from your policing experience that the sale of the drugs then, since the consumption has been decriminalised, that the sale of the drugs has become more or less concentrated in certain geographic areas?
We cannot say that because, taking into account the experience, since I remember, since I was a police officer in '94, we have the same strongholds for the last 30 years. Even though that they are changing sites once in a while, depending on the police action, we still have the same areas that usually are identified. I'm not saying that they are low-class areas, but they are social neighborhoods that are much more, even though that the way that the buildings are built, they are much more easy. It's much more easy to sell drugs because there's much more kind of architectural protection of the illicit activity.
So would you say, and we would describe that as probably a socially disadvantaged area,
Well, yes. Okay. We can. There is an argument on that, but
okay.
we can use that definition.
Okay, but you've no, and I don't need you to provide the statistics now. But have statistics been gathered in Portugal on the sale of drugs since the decriminalisation? And I'm particularly interested to understand if the sale of drugs has increased in a dispersed way or if it has increased in a concentrated way. And if you don't have that, if you think that's data that you can get your hands on at some point, that would be useful.
Well, it can be, because I understand your questions and it's very valid, and I'm just thinking because right now, for example, in Porto, they're highly concentrated, for example.
Okay. Then my other question for you is, in policing practice, and I know this has been asked a couple of times, but it is an important point for us to understand the policing practice. So, as I understand it, police in Portugal understand that drugs themselves have been decriminalised. So, if somebody is consuming drugs, the police then engage with the individual if they're consuming it in a public space. They engage with the individual because consumption in a public space is not decriminalised, is it?
Well, that's one of the points. The consumption in public space, it's not a crime.
Okay. Okay.
The consumption, I would like to re-emphasize that consumption in public spaces, it's not criminalized, and that's something, if you are revising your drug acts, that you should bear in mind, because the public exposure of drug use in public, it's very strong for the other people that has nothing
It's
to
very
do with drugs.
contentious.
And
Yeah, it's very contentious.
It is.
So can you describe to me then why a police officer would engage with a drug user? What triggers it? What triggers the engagement from the police person?
Well, previous experience with the individual or with the context of the individual. Most of the times, of course, the police officers are much more keen to work as a pure law enforcement agency. Okay. That means if they have some information that can lead this individual to any criminal activities, and I'm talking about that most of these individuals, even though that they are drug users, they are connected with other criminal activities, especially when we are talking about minor criminality, like, for example, thefts.
Okay, so the police activity is being informed by an investigative process. The police have conducted investigations in the background or in advance, and then that brings the individual to their interest.
Yes.
Okay. And then one last question, just when the police engage with the individual, they invite the individual to attend with them, to come with them to a police station, correct?
Yes.
Yeah. The drugs that they're holding are weighed and analysed.
Seized.
Yeah.
And seized.
And seized, okay. And then they are invited to participate in a dissuasion committee process.
Yes.
If they don't engage with the dissuasion committee process, are they then prosecuted?
No.
None at all. So they can just walk away.
Basically.
Okay.
Because we are talking about because they are not restrained for their freedom.
Yeah.
And that means the police can do nothing, because the individual treatment is based on voluntary action from the individual. That's the main issue.
Okay, I am over time. I appreciate it. Can I ask one more question? Okay, thank you. So I feel I'm abusing my position in the chair, but it's just thank you. In Ireland we have an injection facility. We don't have a consumption room. Okay, we have an injection facility. We don't have a consumption facility. So it is only for injectable drugs. I'm not sure if you're aware of that.
I was not, because our DCRs are for both, are for smoke and for all kinds of drugs.
Okay.
But basically for smoke and for injected drugs.
Okay. And how many consumption facilities do you have in Portugal? My understanding is it was 3, but is it only 3?
It is 3. Well, there is only 3. That's one thing that can be highly criticized, because you don't have drug users just in Lisbon and Porto. And these kind of facilities actually can reorganize the drug consumption around major cities. That means that may have a direct impact in drug dealing as well. That's something that can be highly criticized, especially because I know the DCR should be spread around the country, just to avoid this kind of concentration of drug users, because this will have a direct impact in drug trafficking.
Of course it will. And am I correct in understanding that Portugal also operates mobile consumption centres?
Yes, actually there is one it's not, they are containers in Portugal that can be built. Well, we can tell that is a fixed as infrastructure, and there is a van that goes to some specific areas.
Okay. And then in terms of policing, again, I would think one of the criticisms that I hear often in terms of policing in Ireland is that there can be at times an element of policing practice that is, and I want to be careful how I say it, but that there's a kind of a containment, let's say, element to the policing practices. So if the activities are contained in a certain area, the policing of that area is either intentionally or unintentionally facilitating a level of activities, and there's an efficiency to that. Has there been any, like when you talk about when you mentioned there the 3 consumption centres and the activity that has attracted, is there an element of that going on?
No. One of the things that, and actually I think we will probably very soon will write something about it, because, well, I have a very close relationship with the officer that is in charge for the drug facility. And from the beginning there was, well, a kind of, well, the police is not very welcomed at the vicinity of the facilities. But suddenly they realized that the police is part of the solution and not part of the problem, because we had major fights in the front door of the facility, we had stabbings, and we had other kinds of criminal activity at the vicinity of the facility. And suddenly it's the consumers that most of them, they prefer to have the police force nearby them than far away. And that's something that I would like to write, probably even in a scientific paper, to explain what is the role of police in these kind of facilities. Because I'm assuming, and that's the experience that we can gather from Porto experience, that in drug consumption rooms, the police is not an alien. It's a co-worker in a certain extent.
Okay, thank you very much, and I've gone way over time. Apologies. Deputy Graves, do you want to come back in?
Thank you for your question.
Just very quickly, and I want to thank you for the discussion. I found it actually very enlightening. And just to kind of refer back, I was a bit flippant about our draft strategy in the beginning. I think we are moving forward, and it is a positive that we're moving towards a health-led approach. I do have some kind of issues with it, and one of the things is the change in legislation. And I think even among the members within the committee, we're all going to have different views on it. Even among our own parties, there's different views on it. But I think the discussion kind of clarified quite a bit for us the fact that it's discretionary and it's left to the discretion of the Gardaí. So really the change in legislation is a little bit mute. But one thing, and this is on foot of Senator Fitzgerald, speaking about the concentration in areas where drugs are sold. So presumably selling drugs is still a criminal offence, while using it is not. But if you have areas where, you know, it's almost like a market for drugs, would it not be a case that I was about to say the Guardian, but the police force would swoop on those areas and charge the people that are actually selling the drugs? Or are they given free rein to do what they want?
Well, I understand your question, and thanks again. I think we cannot... Well, the drug dealers are easily identified, and sometimes it's very difficult to collect evidence and to gather evidence, because most of the good drug dealers are not touching the drugs. But one of the things that is very easy and to see in Porto and in other places, not just in Portugal, it's that, well, the police just changed the corner of the drugs. The police sections are not solving the issue of the drug consumption. They can solve one small part of the drug trafficking, but they are not solving the main issue that we are discussing here, is the drug consumption. And there are some authors that defends that the police just changed the corner of drugs. And we have that very clear in Porto, because we intensified, we had a huge police operation in one of these social neighborhoods, and we had a strong presence 24/7 for 3 months in this neighborhood, and the only thing that we had was a spike of drug dealing in a different neighborhood. So,
if you live on that corner.
Yeah. Okay, thank you very much.
Deputy Muraku?
Yeah, because I would just continue on with that one, and I can just think of a number of issues that have arisen even in the last while where you get an element sometimes of drug dealing, sometimes even drug taking, some of it very chaotic. Obviously, you're going to have drug dealing that happens not very far from that. And in an awful lot of cases, you're going to deal with residents and whatever. They will, as much as, it is displacement, but they'll be happy enough if that displacement is away from their front door. As I say, dealing with the underlying drug problem is a far bigger issue. I think you've actually sold the Portuguese model very well. I think you've addressed some of the issues that have been, I suppose, even the objections that have been put up by the guards and others around it. And I suppose then the bigger one is it will only work if the support structures are there, because there's not much point of putting someone even to the equivalent of a commission of dissuasion if you don't have whatever supports are required, be they health-wise or whatever else. So, if you could answer that issue, because you brought it up before about that visibility of drug taking and the fact that that is an issue, and then beyond that, the advantages that you have seen. Obviously, we've seen some of the figures around the stats, obviously, of lives saved, of less people engaged in, dangerous drug taking and all of that. But even from your point of view of as a police officer, what you have seen, what the positives are, and then even some of the negatives that still need to be dealt with.
Well, let's start with the negative ones. As I mentioned, the public exposure, I think, is one of the things that we should address at this stage right now in Portugal, because and especially because we have a huge number, an augmentation of drug users. There is a much more public exposure, and I think, technically we should do something on this. The positive thing, it's the reduction, the terrible reduction of the amount of paperwork that were used, that the police was using, the amount of time that the police was using before 2000. Not just the police, the courts, prosecutors, and and I think this was not studied yet. But I think that would be a very good PhD thesis to check it out. What was the effective cost in terms of money and resources that we had with the new law in terms of the reduction of numbers. And that's something that was very clear since the very beginning, because I don't know, probably your system is different, but for example here, when we arrest an individual, we take this individual to the prosecutor. The police officer takes the individual to the prosecutor and has to stay till the first hearing of the judge. So this is very time consuming, and when we taking into account this action with the public safety, there is one less police officer that is that is on the front line for other stuff, for other criminal stuff, and that was very effective from our side.
No, I can imagine so, because look, we've all seen courts being absolutely loaded with an awful lot of issues that relate to low-level activity and that relate to drugs. But I suppose it's also from time to time it's been able to deal with the chaos, and the criminality that comes from this, and wider society that can be impacted on it. And I just here, I suppose, one last question. Have you any proposals in relation to how you would deal with the issue of visible drug taking?
Well, I have some mixed feelings on that. I don't want to express it publicly right now, but
I thought that's the answer.
I have to admit that is quite a headache for the police, because we have people that has nothing to do with drugs, that are living in a peaceful environment, and suddenly they have someone with a syringe in their front entrance, and they ask for the police to go there, and it's very difficult for the police to enforce. Sometimes the police they are just reporting to the spot, and they are just asking gently to this individual that are using drugs to go somewhere else. But still, I think that's something that should be addressed.
No, I can imagine the difficulties that creates for the police in Portugal. Obviously, it is something that needs to be addressed. You did speak earlier about when the Troika was in, and that I'm just wondering, because see, at this point in time, obviously this system works when the resources follow those that need them, be they health related, be they education related, and all the rest of it. It's just the impact that had in any cutbacks, and then do you believe it's sufficiently resourced at this point in time to give them maximum optimal output?
Well, one of the things that was really, because we faced that on the ground when IDT was extinguished, there was a lack of support, and that's something that we should never have on the ground. And especially because, at the end of the day, it's the police that report to the scene, because it's probably one of the only public institutions that are reporting 24 hours a day. One of the things that I'd like to stress as well is that if you want to put money on a strategy, you have to put money to the police force, to the law enforcement, to the social security, and to the medical facilities as well, and to the mental health strategies. Yeah. Sometimes we tend to minimize the impact on mental health for drugs, and there is a huge impact, especially because there are a lot of people that are on the streets that went to that initially they were completely fine, and for example right now they have some mental diseases that could have been prevented if we had enough investment on that before.
Yeah, well, I think we would have a similar issue here in relation to that.
Antonio,
usually we tend to believe that mental health is the poor partner of the system, but it's not.
Yeah. Antonio, we call it the Cinderella of the health service, or historically we have called it the Cinderella of the health service. But you're correct, and it's not. It's not. It shouldn't be. Antonio, we're coming to the end of the committee, and I just have one question for you. You mentioned that there's debate now around the merits of the decriminalisation process in Portugal, and particularly as it relates to the public prevalence and openness, let's say, of drug consumption in public places. You spoke there about the challenges from a policing perspective. Is there a timeline for a formal review? I understand from your contribution that there's public debate and political debate on the issue, but is there a schedule for a formal review of the operations?
Well, as you probably know, the previous Porto mayor was very vocal regarding the public exposure of drugs. And you know that there are some types of legislation that it's very critical politically, is very critical to change, because we are talking about ideology, we are talking about a lot of different issues. I think it's going to take time, because even though that the political debate may be on about the public exposure of drugs, it will take time, and it's not definitely, as far as I'm aware, on the political agenda of any of the political parties in Portugal. There is a major outcry from some communities, as I mentioned, that they are not very happy to have drug users in their front door, and I think the debate will have a new political impact, but there is no agenda currently for that.
Okay, and then one last question. From an operational policing perspective, would it be optimum for the police, for it to be illegal to consume drugs in a public space, based on the experience now? Would that make it, from a policing perspective?
Taking into account that I'm obeying to your rules, and I know there is some not secrecy, but this is a reserved arena. when you abandon a syringe in Portugal, it's a crime. And I think even though that probably, I don't know, I think it should be an offense, to be honest, and especially at the vicinity of some facilities, for example, schools and hospitals.
Absolutely, absolutely. Antonio, thank you sincerely for your contributions here today. Nobody else is indicating, so on that basis, I'm going to conclude our public session this afternoon. I want to thank you, Antonio, and our other witness for their time today and for your engagement with the committee. And the meeting is adjourned until the 16th of April at 12:30 p.m. Garmagad. Slán.
All right, everybody. So forgive my absence there from the camera. Swapped over the computer. The other one is actually inside in the repair store, just getting a little bit of work done. Realised that this one actually doesn't have the utility to run the camera, so I'm going to quickly see if I can get it up and running. So you can see this big old mug of mine. Is this going to bloody load? Just having some issues there with getting this to load on the website, probably because the stream is running. Come on. Anyhow, a great meeting there. And again, in fairness, like some silly questions being asked by some of the politicians, but the contributions again by the witnesses were, yeah, they were very good. A lot of sense being spoken. Much like last week, I suppose, you know, the contributors there from Portugal, they really had a great contributions to make, in fairness. That final bit there, they were talking about public drug use in public and making that illegal. Like, I wonder, are they, like, meaning all drugs? Like, because if they want to make drug consumption in public illegal, like, what does that do for, you know, you walk through the city on a lovely summer's day and you'll have all these pubs with people outside enjoying the sunshine, enjoying their pints, smoking their fags. Like, are we going to do away with that? Like, you can't go outside with your pint. You're not going to have somebody at the door stopping you, taking your pint out. You're only allowed to bring out your Raza, you know. Will more people start drinking Raza with their vodka or whatever? Less beer, less wine, whatever, you know? Like, how do they police that? You have a fella coming out the door with his pint of Guinness. How do you know that's not a 0% Guinness? It's insane. You know, it's just no different from a fella walking down the road smoking a bit of CBD cannabis. Like, how are you going to know if it's actually CBD cannabis? Like, why can't you just enjoy a bit of CBD cannabis walking down the road? Silly, absolutely silly. The concerns there that they kept bringing up about the... one second. No, this isn't going to load here at all for me. Why? I don't know. The stream has been going grand. There's been no issues there, thank God. Boom. There we go. Let's have a look at the lovely backdrop of Cork City. And if you notice there, that clock is at 4:20. Yeah, I see scrapping stuff, Bobby. Yeah, they were talking about a bit more sensible, says Bobby, and scrapping stuff, saying very positive meeting overall. Certainly was, much like last week, and like Bobby says there, they were definitely talking a lot more sense. I just wish they went further there on that conversation they were having about the drug use, the concentration of drug dealing in certain areas. Like, I really wish they just expanded more on that and the issues that prohibition create. It's only prohibition creates this issue of drug dealing. Like, a few areas, what would you say, stores, like even chemists for certain drugs that were allowed, they were licensed to supply these drugs. Like I always kind of say, cocaine is a difficult one to argue for, but look, it's already there, it's out in the street. If you want to take it off the street, take it away from the criminals, then I think the best people that you could give it to are pharmacies. You just give them a license to be able to distribute the cocaine, come up with some sensible regulations around its use, sensible regulations about its distribution, proper education on its use, you know, health-led approach, a truly health-led approach. Oh, I'm talking on the camera, buddy.
Why?
That's why, because I'm streaming. Can you talk? You talk there, so say hello.
Hello!
Hello.
I can't hear.
You can't hear? No, you won't be able to hear it at all.
Why?
That's why, because it's not playing on the... There. I can't hear it on my headphones either.
Daddy, who is it?
Who is it? It's nobody. It's everybody out there on YouTube watching. Do you want to come over and say hi as well, Avery?
Who is it?
No, you missed her. You get away from all the buttons down there. Here, you can say hello as well. No, you can say hello. No, you're shy. No, Avery's too shy to say hello. Go on, scoot on out there now, so guys, go back down to your mammy. Go on. What, buddy? Oh, go on, so. Sorry about that intrusion. Wearing warning headphones users. Yeah, apologies. I should have known he was going to do that. Sorry, guys and gals. This bloody Canon thing isn't going to load here. So again, I'm here. I'm speaking to you anyway. You don't really have to see me. There's no big issue. But yeah, that conversation around drug dealing anyway, this definitely needed to be had. Cannabis, it's an easy one. They mentioned Switzerland, and I can't believe they didn't bring up the fact that they done an experiment. It was a trial. Like that's the perfect thing to bring up there in that committee, because its goal was to gather data to figure out if this is the right thing to do or if it's the wrong thing to do, if it's going to be more harmful or if it's going to be harm reduction. You know, it's just so frustrating when they don't do this. Also, we got out there in Commontville, out the hot box, Weedabex, Martin and his gang of kids. Yeah, that was just 2 of the 4. Barry says, I heard a mad story recently about a guy who never drank or smoked, but tried coke at under 10's GA match. I suppose the boys, the little 10-year-olds, they're full of beans. So if you were kind of feeling a bit down, it's definitely a better way to pep up than, well, not a better, but more effective way probably to put a bit of pep into your step than caffeine would be. And maybe there was no coffee machine nearby, and they just said, oh yeah, sure, not a bump there, what harm? Bobby says I'm the weird American uncle. Uncle Bobby. Let's say. I was wondering what that noise was there for a sec, but it was my squeaky chair. Anything else of value there now to be mentioning again in that meeting? Anybody out there have any comments to make, opinions, thoughts on anything that was said? Just trying to think back there now as what they were going on about. The public consumption of drugs, yeah, we kind of mentioned that. I'd agree with them there that can be an issue, certainly. Especially in doorways. Homelessness, that's one actually that we wanted to have a quick chat about. They ignore the fact that a lot of these people don't have a place to actually go and use these drugs. Unfortunately, some of these people who are caught up in drug addiction, which is what they're really, really focused on there, seem to be focused on anyway. A lot of people homeless, unfortunately, tend to get caught up in the drug addiction. Do you know, and a lot of it's mental health. They're trying to escape from the reality that, hey, I'm fucking living on the streets, this is shit. And they lean towards drugs. These people then get preyed upon, unfortunately, by some of the drug dealers in the area. You know, that it's just been victimised time and time again, when in fact they should be helped. If a person is seen out in the street to be injecting and that kind of stuff, they need a helping hand. That's what they should be offered, as a helping hand. We already have laws there that are like, you can protect the person from themselves when they're posing a danger to themselves or to the public. I do believe we have laws around that, and a person can be taken in because of that, can be arrested for that. So there certainly is means there, solutions there for the public use of drugs. But they need to be specific. You know, the public use of drugs, that's not really the issue. It's the public injecting of drugs, really. If a fella is out in the street and he's taking a bump of cocaine, you know, it's not really an issue. It's done and it's gone. Like, I suppose in Cork City, we have a no open tins policy in the city, where people can't go around with an open can of beer, they can't go around with an open bottle, they can't be openly drinking in the street. Now, that's a city bylaw, so there's cities out there like down in Killarney, Galway, I believe, that bylaw doesn't exist. So there certainly is mechanisms there that we can put into place to solve this issue around the public consumption of drugs. Again, I just wish they'd dived a bit deeper on that conversation. Alright, on. You don't stream to Twitch anymore, no? I haven't in a bit. I should get back to the premium account over on the Streamlabs. I let it lapse there during the kind of the break I had from streaming. Since getting back, I just haven't switched back on the premium side of it, which allows me to multi-stream, so I'll be able to stream to here, YouTube, or here, Twitch, Facebook, and some other places. So I certainly will entertain the idea of getting back into that there sometime soon. Was that where you would have caught me over on the Twitch? There was a couple of people that were specifically over on Twitch. It was Man Falls. Ah, yes, Man Falls. Yeah, definitely one of them. Trying to think of sugar. I can't remember his name now. It'll come to me now as soon as I end the stream. Yeah, that fucking webcam thing never loaded. That was annoying. Serenable, done for €5 worth of weed. Man, that's a joke. Absolutely ridiculous to get done for that amount of weed. I'd imagine, and when I think of it, I was probably around the same. It was hash that I got caught with. I think it was like $7.50, I think they said in the court. €7.50 worth of hash that I got caught with. That was the lowest amount that I've ever been charged for. Don't think I actually got conviction for that either. Got the benefit of the donation to the charity box, you know, that little scam that they pull in there. So yeah, that was the lowest amount I got. Scrapping stuff there, saying everyone don't forget the Patreon donations, keep these streams coming. Absolute legend. Scrapping stuff. Yeah, just went in there now earlier to get the computer back up and running. Gonna go for they were mentioning that they've got a second-hand GPU and SD card, so fingers crossed there now that they're going to be decent once I get them up and running. But thankfully it came in at just under, I think it's €170 that I'm going to be paying for both of those, which isn't bad considering the GPU, the new one that I was looking at, was €390. Nuts. So yeah, I'm going to go and pick them up. So I'll be back hopefully there next week with or not next week actually, the 16th of April is when she said the next meeting will be held. But I'll definitely aim to get back before then, do a couple of 420 news maybe in between then. Maybe get one or two people on for interviews. Myself and Endo with Amy over there on Instagram were talking about doing a couple of interviews that were patient and medical cannabis focused. So maybe that might happen in the coming days, weeks. But yeah, nice one everybody out there for just coming back. Even if you don't donate or anything like that, guys, I just appreciate people coming in and watching. Once I'm not watching these things alone, speaking here to myself, happy days. Oh, I got a visitor coming back there now, 1 second. Hey, watch your fingers and I close the door, love. Yeah. There you go. Oh, little weasels. I have to barricade myself in here. Just put something up against the door, but that's probably not even going to be enough to keep them out. But yeah, there's been a couple of people over on Patreon as well who've remained there throughout even the absence that I was. So you're absolute legends. Strandable says, anyways, missed you, Martin. And I missed you guys, honest to God. I was delighted when I got back to the stream after my absence. I wish I didn't have to be on here doing this. I will say that. I wish I didn't have to be campaigning for this fucking change in laws. I wish they were just changed and I could get back to living my life, being out there doing what I'd like to be doing. But unfortunately, it is what it is. We need to be campaigning, getting it out there. But doing this, I actually enjoy being on here with you guys. You're all a bunch of legends. Got to meet some amazing people over the years while campaigning for cannabis legalisation. You all know who you are out there. All of the members of the Cannabis Activist Alliance, the members of the Grassroots Social Club, and many more before that. What else had we had? We had Legalised Cannabis Ireland. We had SSDP, Students for Sensible Drugs policy. Geez, there might have been one or two other kind of names, groups that we would have worked under, campaigned under, that I met amazing people through. So yeah, absolute legends, everybody out there. Martin, do you know what the Limerick Mayor Moran thinks of cannabis? I don't. I've not seen anything specific from that mayor. Fingers crossed it's something good. To be fair, like all of the crap that goes on above there in Limerick, you would think that they might have a bit of a positive opinion on it, because it's fucking taken away from the Gardaí resources up there to tackle the more serious stuff that goes on up there. I think that was over the Limerick border, that more recent attack, or a woman is fucking on a critical condition on life support after being belted with a fucking axe or something like that in the back of a van and out on the side of a main road. Some of you might have seen that video going around. But to imagine like that the guards are the same people who deal with that, are the same people who deal with, fucking Serenables, €5 worth of weed. Like while Serenables getting stopped at the side of the road or whatever with these €5 worth of weed, there could be a much more serious crime going on 5 minutes away, but those two guards that are there searching and stopping you, taking away your weed at the side of the road, they're going to be there dealing with you for what, maybe 15, 20 minutes, 30 minutes, depending on how big your car is, how long the search goes, and maybe how you're cooperating with them, That's the thing that gets me, you know what I mean? I really respect the guards for what they have to do for the most part, the stuff that they do out there, the things that they probably see, it's insane. It's Mister, stop. Mister, hey, watch your fingers. Little fecker. Lovely, the small little pets. Lock the door, mate. The key, I think herself has the key hidden somewhere, because the little farty finds the key, took it out of the door, and he chucked it down the toilet there one day. Thank God we didn't flush. So I'm actually up here around the bedroom, and I have his sister's cot up against the door, trying to keep the little fart out. But it's great, not complaining at all. They'll be growing up one day, they'll fly the coop, and I'll miss all of this. And that's another thing that kills me, you know what I mean? The amount of time, effort, energy that myself and many others have put into this campaign, that's time, energy, effort taken away from our families, our friends, our lives. But we do it because, it's the right thing for us to be doing. What's going on? Did I miss anybody's comments out there in the hotbox? Weedabex, Mary kind of started well, but diverted into making regulations impossible. Disappointed in her. I will say that as well, Weedabex. Her contributions, her questions over the last number of meetings, always kind of would have put her on the better end of the questions. Today, alright, was a bit of a letdown. She could have saved herself if she followed up there. Really, she would have done well if she just followed up about the drug dealing being concentrated in certain areas. That, look, actually, would it not be better that these areas have a regulated supply in there? If you've got a drug consumption room in an area, would it not make sense that that area would have a safe, regulated supply of the drugs that are being consumed in those rooms? But she just didn't do that. She just didn't. Oh, she was so close. It was just there. All she had to do was just open her eyes, reach out, and it was there for the taking, within arm's reach. But yeah, it was a bit of a letdown, disappointment in her. Lynn Rowan done great there as well. She brought some excellent facts to the conversation around the what goes on in court, the charges for the personal possession of drugs. I believe it was over 5,000 charges in 2025. I think that was the number she gave, and I would imagine the vast majority of those charges were for the personal use of cannabis. The vast majority of them. Your man Rory O'Muraku actually was another fella. He's pretty bad for questions. He really is. His questions today, they weren't great. Nothing really kind of standing out there now as I'm thinking of it. Nothing jumps to mind. I know himself and Colin Burke, they were very much focused on addiction prevention. That's kind of another thing that kind of grinds me gears. This focus on addiction, this focus on prevention, and very little, like, the health-led approach. The health-led approach should acknowledge that some people use drugs in a non-problematic way. Like your people outside of the pubs, drinking a pint, enjoying a lovely sunny evening, probably just after finishing off a week's work. They're out there on a Saturday or a Sunday, catching up with friends, family, enjoying an old pint. Like, that's non-problematic drug use. We don't see those people as drug addicts, and that's something that needs to be highlighted at these meetings. And it's really frustrating that they don't acknowledge that. Wiedebeck says he makes statements rather than questions the Sinn Féin fella. He's a rambler. Yeah, that's his contributions. He doesn't really ask good questions. He'll make a statement and he'll ask the speaker to give their opinion on that statement or kind of continue on from the point he was maybe making in his statement. And that's disappointment. That's disappointing in him. Because he really needs to learn. He's another fella with his head in the sand and a bit of an ignoramus, especially when it comes to drug use. Because I don't know if he is or isn't, but I can imagine that he probably is a fella who likes his old pint. He probably goes out on a Saturday evening, a Sunday afternoon, whatever, and enjoys an old pint. Maybe he's gotten a bit more health conscious about it, and he's after switching over to the to the Guinness Zero, as I mentioned there earlier. Maybe so. But again, that's something that should be available. It's only available because the drug supply is regulated. Do you think for a second, if alcohol was illegal, that people buying an alcohol-based drink would opt for an alcohol-free drink? Do you think drug dealers, if they were in control of the alcohol market, would start offering the option of an alcohol-free beer? They wouldn't. Greengrocer says cannabis was an addiction prevention for me. Alcohol and post-surgery opiates. Yeah, you're not alone there, Greengrocer. I get that now, actually, the Greengrocer. Yes. I see what you're doing there. You're not alone in that either. There's many people out there who say that cannabis, it's a gateway drug. It's a gateway away from other drugs. Do you know that's what I've heard, is that cannabis for many people is an alternative to things like alcohol. And we've talked about alcohol zero. These alcohol-free drinks that are, what would you say, like fucking the Heineken, the Guinness. I know a good few people who switched from alcohol-based drinks because they're able to have a smoke with that pint. They'll now have an alcohol-free pint and they'll have an old smoke with it. They'll sneak out around the side, have an old smoke and go back in and they can enjoy that alcohol-free thing. Whereas before, maybe they were more worried about their cannabis use. Maybe they weren't even consuming cannabis. They were going out smoking fags and drinking the old pudding. The strong stuff. Go for the strong stuff, bye. Yeah, it's funny, my old man, he likes his pints. And I can't remember where he was now. It was outside of Ireland. And he was just on about like some of the stronger beers. I think he was out for a game, watching a soccer match over in Europe somewhere anyway. And he was on about those becking beers. He didn't even realise that they were like 8% volume, 10% volume. Much stronger stuff. He said, yeah, I can remember it now actually. He was on about it. He had 2 or 3 pints of the stuff and he was goosed. He had to go back and tap out early. Ruined his entire night, he said. Sir Annabelle says, what addiction? What about addiction to love? Love, you thought about MDMA? Yeah, that's true as well. Like, you know, addiction is not always a bad thing. Like, I suppose, what's the difference between an addiction and a habit? You know, some people can, they can just be so habitual that like there's no differentiating it from addiction. Like, they're addicted to what they do. Like, I drink coffee every morning. It's a habit, but it's also an addiction. But it's not problematic. It really isn't. And there's no problem in actually dealing with it. If I don't want to have a coffee in the morning, I don't really have to. And that's the exact same, to be fair, with cannabis. I enjoy cannabis. It's a habit. There's a habitual use that goes on there. But if I decide, do you know what, I'm just going to skip a bowl, I might wait until later on this afternoon before I have an old one. I won't make and bake today. It's no issue, you know. So again, like, well, where's the accommodation for me? Where's the harm reduction for me? Where's the health-led approach for me? I am not included in those discussions. I said it last week that was probably the first week that there was a speaker there that truly represented me, the non-problematic drug user. But outside of him, one person over, how many speakers have we had now? About 50 speakers, over 10 meetings, was it? And only one of them actually was a person that I could say represented me in some shape or form anyway. The non-problematic drug user. Much of yourselves out there, guys, somebody can put up their hands outside of there and say, like, yeah, I'd use a drug in a non-problematic way. I use a drug and I'm not an addict. I use a drug and I might have a habit formed around the use of that drug, but I am not an addict. One says, fuck, I must have a coffee now. I'm fainting. Barry says, the first time I tried pudding, I was 12 or 14 and my dad gave it to me. He was probably doing it as a laugh. I thought it was 7-Up and the Alpha. Yeah, exactly. I didn't even finish what you were saying, and yeah, that's exactly what it was. Your man turned around to his buddies and he goes, "Watch this, lads. Here, Barry, will you have a sup of that there? Will you try that?" Yeah, I can remember as a young fella, at least I don't remember it, but like getting the cream off the top of the pint on a dummy. Yeah, there's cream off there. There you go, mate. Have a suck on that. Do you know, different times. But in saying that, actually, like, my missus likes the glass of wine from time to time, and there's been times where the smallies have come along and, oh, I want a sup, like, and you give them a little sip, just, and you kind of laugh, as Barry's did, like, you know, you laugh at their reaction, the face. Yeah, it's the same reason you give them an old lick off a lemon. It's the same reason as a young fella as when we used to lick those little square batteries. Medical and recreational user here says, on effective cure for my Crohn's, and put a bit of hair on the chest. Yeah, some of that stuff that's going around now, I don't get it too often, but those dabs, good lord, they'll put hair on your chest. Or at least they'll put your lungs on a table with the amount of coughing. They'll get you going afterwards. There's always a bit of a delay reaction there as well. you're playing poker and next the rig comes out. You take a hit, like the game of poker stops for about 5 or 10 minutes. Everybody's just coughing their lungs up. those things hit hard. Barry says, I used to take the cream out of the cakes and put it on top of the cola to look like grown-ups. Yeah. I can remember drinking Sidona and thinking, you know, I'm drinking the Sidona, and it's like the cider. Say Sidona, was that maybe the first like fucking alcohol-free cider? Unbeknownst to ourselves, we were all drinking alcohol-free cider. Or he says earlier there, tell someone you're making it, they think that's great, a bit of crack, but say you're growing weed, yeah, and they think it's way different, and that's in relation to pudding, yeah. No, that's true, that's so fucking true. That's the crack with pudding, actually, isn't it? There's just traditional licenses or something like that available. There's not. I don't know if there's new licenses being given out for the production of it, but I think there's a few producers around Ireland who still have a license. They've been grandfathered into it. But that's not to say that there's a few fellas out there that are just making it on the side. And yeah, ourselves dad, he'd be big into the dogs and the hunting and stuff, and there'd be a few fellas down around the Kerry area anyway. He'd come back with an old bottle of it. Great for the joints, apparently. And not the ones you roll and smoke, but the ones that creak and crack when you get old. My fucking knees are playing havoc on me now at the moment, but I've been doing a fair bit of running, getting ready for the marathon. I'll throw that out there, actually. Can I pull that up? Oh, let's see. Will that load? I doubt it will. No, that still won't load either. Don't know what the crack is there. I was able to stream the video all along, but can't open any pages now. Anyhow. But yeah, same with the Sidona. Heard the lads using it on the greyhounds and horses. Yeah, exactly. It's good for them to give them a rub in. And yeah, it makes sense. Greyhounds are horses. Do you know what I mean? Heavy stress there on the legs, the joints and around it. I'm just thinking there now, actually, I wouldn't mind if I brought the bloody vape up in my grinder. Right, so I don't have anything else there now that I think that I need to add any other announcements or anything like that. I'll be meeting with the guys at the Grassroots Social Club later. Putting a bit more work into organising the next social event. Yeah, there's one coming up on Sunday, but it's weather permitting. Looking at the weather so far, it's not looking great. Fingers crossed there that the Ganja gods might shine on us that day and change the forecast. But right now it's not looking great. We'll probably make a final call on it tomorrow morning. Oh, there's a street sweeper going by outside. I knew I could hear something. I thought my bloody laptop was about to blow up there. But yeah, if I can, next Sunday, Cork City, get in touch with the Grassroots Social Club, social media, the Instagram, Facebook, email, sign up there, let them know you're interested in going along, and they will send you the location. I'll say it's in Cork City, up in the north side. I won't give away the exact location, just for the safety and privacy of our members. So that's just a free social event that we're just going to have a gathering in a public place. We're going to go for a walk. We're going to have a little bit of a picnic, and there's an opportunity there as well to go back into the city afterwards, where we will go to the Marina Market. Marina Market's a lovely spot in the city there, down along the just next to the water, so we can grab a bit of food there, and again another opportunity to go for a lovely scenic walk up along the waterway by the Black Rock Walk, or Park Equive, yeah, or what's it called now, Super Value Park, isn't it? So yeah, that's all the news and excitement coming up in the next while. Wiedebeck says, thanks for hosting the show, Martin. I have to shoot on, so chat later. Bye. Keep her lit. Peace. Yeah, much love, Wiedebeck's. Nice one for tuning in and for keeping us in, keeping the comments going, conversation going here in the hot box. Barry says, "Fook the weather." Yeah, there'll be diehards like yourself, alright, who says "Fook the weather." Yeah, maybe ourselves can keep going with the meetup anyway at our spot. And we'll let others know there to bring their rain gear. It's like not a street sweeper at all. That sounds like a cement truck or something out there. Schmidt Fair's nice. Right, so everybody, as I say, get over there to the Grassroots Social Club anyway. Sign up, follow all of that stuff, and make sure you come to our events. We're going to have an AGM later on in the year. It's going to be a 2-night AGM, so there's going to be a big social element to our AGM, but all members are going to be welcome along. So tickets are on sale now, so get over there, follow, like, all of that stuff. Barry, everybody else in the hot box, guys, this has been an absolute pleasure to engage with you there today, to watch that meeting alongside you today. Until next time, I guess, keep her lit, stay blazed, much love. Toodaloo.